This is what you need to know for the baby-friendly staff interviews. For Level 1, there are 4 questions. You will need to know all answers. Make sure you watch this more than once. It is important that you feel confident in answering all questions. Question 1. In what ways does your children's centre create a welcoming environment for breastfeeding families? Signs that make it clear breastfeeding is welcome. We run breastfeeding drop-in groups. We provide comfortable areas for feeding. We offer private space if required. And we provide water for breastfeeding mothers. Question 2. Why is breastfeeding important to mothers and babies? Breastfeeding can prevent infection both in the baby and the mother. For the baby, it can help prevent gastroenteritis, respiratory infection, sudden infant death syndrome, type 1 and 2 diabetes, allergies, and childhood leukemia. For the mother and baby, it can help reduce the risk of obesity and cardiovascular disease. For the mum, it can help reduce the risk of ovarian and breast cancer and osteoporosis. It also helps provide a foundation for positive mother-child relationships. Question 3. A baby milk company representative comes to the centre and offers to provide leaflets and DVDs for use in parenting groups. They assure you that their name is not printed anywhere on the information. How would you handle this? You should show an awareness that we will not accept any company literature. We should also be able to discuss that advertising can undermine confidence in breastfeeding. Question 4. If a mother asks for help or information on feeding or caring for her baby, what do you do? Your response should be appropriate to your role and training. If you have not been trained to give advice, you should not do so. However, you should make it clear that you would signpost or find out information from a colleague. Question 5. Why is it important for parents and babies to develop loving and responsive relationships and not to be left to cry for long periods? You should be able to explain how responsive feeding helps the baby feel secure. It keeps levels of stress down and that it is good for attachment and brain development. Question 6. What helps parents develop loving and responsive relationships with their baby? You will need to answer 3 of the following. The importance of skin contact as a calming effect. Talking to and responding to babies. Not leaving baby to cry. Picking up and comforting will not spoil them. Question 7. How would you explain responsive bottle feeding to a mum? Hold baby close. Have eye contact. Invite baby to take teat by gently rubbing it against the upper lip. Pace the feed. Don't force a full feed. And limit the number of people who feed the baby. Question 8. What other information does a bottle feeding mother need? How to sterilise equipment. How to make up feeds as safely as possible. The type of milk to use. For instance, first milks until the baby is a year old. Question 9. A mother tells you that she is thinking of starting solid food when her baby gets to 4 months old. What would you say? That it is best for most babies to start solids at around 6 months, as their gut is then mature enough to cope with food and other than milk. And finally, question 10. A mother comes into the centre and tells you that she is thinking of stopping breastfeeding because it is hurting. What would you say? you should be aware of how to refer to breastfeeding support for that mother.